Hello everyone, welcome back again. Good afternoon, and I hope you had a nice morning working on in your OR and clinical practice. This afternoon session of faculty development is directed to help us teach how to elicit and integrate patients' values into our clinical teaching and into clinical decision making and teaching medical students. So by the end of this session, we should be able to define the value-based practice versus evidence-based, so VPP versus EPP, understand how VPP skills of awareness, reasoning, knowledge, so what are the skills that we want our students to be equipped with, develop framework to teach the VPP in our clinical teaching. So first of all, what is the value? What is the definition of value? What are values? Values are those principles that govern our behavior. And values can be different from one person to another. We're going to see here a few values that we can connect to or commit to, but other people might have completely different values. The reliability, the quality of life, the flexibility, the support, it could be anything. So values in the healthcare is our interest today, and to define values in the healthcare, some of our clinical teachers would define them as synonymous to ethics, but values are more than ethics. They have a wider overarching umbrella than ethics. They include the ethical values in addition to considering the patient's preferences, needs, hopes, expectations, and so forth. The diversity of values presents within the healthcare encounters, and so if we look at the values from the perspective of different people in a clinical encounter, we'll find that for example, for the clinician, what could be the values? The values for the clinician could be high efficiency, patient-centered care, multidisciplinary approach, and cooperation with other colleagues. For a caregiver, it might be completely different. It might be the values might be the life stability, cost, the time, efficiency, and family relationship. For the manager, a completely set of values you can see: negotiation ability, risk sharing agreements, staff recruitments. For the policymaker, it might be another higher stakes set of values, which would include increased coverage to clinical encounters or clinical settings, investment and focus that are focused on needs, less cost, and outcome based in cost efficiency. For the patient, though, who is the center of all of this, the values might be better overall health, more engaged in goals of clinical decision making, and less cost associated with better care, and for the patient to be heard. And that's our interest, is the patient-centered care in the center there. Why would value-based practice be important in the healthcare setting? Ideas? Well, it is important because it would guarantee or would help us work in a respectful, sensitive way to the patient's need. It will also help improving the healthcare services, healthcare outcomes, and considering the healthcare indicators for patients. And again, what is the value-based practice? What is the VPP? Theoretically, it is the theory of the skills based on effective healthcare decision making. That's according to Wilford definition in 2004. We'll have some questions here, and just to consolidate the previous few slides, and then we'll move on with more. So 2 pillars of patient-centered care from your pre-reading or pre-session reading. What are the 2 pillars of patient-centered care? Are they the research and population? Are they patient's preference and scientific data? Are they bioethics and physician values? Patient preference and physician values, or are they the scientific and conference data? Correct, they are the patient's preference and scientific data. Question 2, what is the value-based practice out of all of this according to Wilford definition? Right on, it's the value, the VPP is the skills or the set of skills for effective healthcare decision making, where different values are in play. So it's the choice of number A. What are the main practice skills of value-based practice? It is the awareness, reasoning, knowledge, and communication. And for those who would wonder where they can find it, you can find it in the definitions in the pre-session reading. The 2 feet principle of VPP is actually the healthcare decision relying on values as well as scientific facts, so APP and VPP. And the final question is, which of the following sentences would explain the squeaky wheel principle of value-based? And that's again in the paper, including in the pre-session reading. So the squeaky wheel was defined as, we tend to notice the values only when they are diverse or conflicting, and hence they are likely to be problematic. Otherwise we don't notice these values. Okay, so back again to what are the skills that we are requiring the students to be equipped with. We want them to be aware, we want them to be able to do clinical reasoning, knowledge, and communication when they are in a clinical encounter. And VPP practice skills of awareness, how would you define, how would you like them to be aware? Values are not always evident. They are just like the air, and we have to communicate this with the students. They won't be seen, they won't be smelled, but they will feel them during your communication with the patient. An essential first step is to be aware and to raise awareness towards values. VPP practice skills, the reasoning. Now, this is the second skill. Reasoning is in VPP is about opening up to thinking, and you have to be able to make clinical reasoning for VPP. So by varying the details in the case, we noted our differences in reaction, or our different reactions. You have to be able to map out the values and ask the patient about it. Comparing cases, by comparing case-based reasoning, you are again able to do some raising or eliciting of values. VPP skills of knowledge. So knowledge you can collect through first-hand narratives, through surveys, media reports, or social sciences, and these all might include some patients' values. To wrap up this part, we have to agree that value-based, or we must agree that value-based practice is about linking the science to patients' values. There is part that's evidence-based and value-based, and we cannot separate them. We can't depend on one versus the other. They are actually complementary to each other. EPP versus versus VPP are very complementary. 10 principles of value-based practice. The students will find them in the readings, but also you can discuss with them based on different sessions. The 2 feet principle is what we talked about, that the scientific evidence or the value is based on the decision making, is based on both scientific evidence, which is the EPP and VPP. The squeaky wheel principle is we don't notice values until they are actually jeopardized or problematic, as we said in our questions. And now the scientific driven principle is scientific progress in expanding choices is increasingly, it brings to a value to human life. Introducing VPP early in preclinical years. So for you as teachers, what would be something that a take-home message? Preclinical years are valuable. We have 2 preclinical years, and then the students will be practicing. Introduce the value-based education into these years. This is some of the toolkits and background. Again, I will share with you at the end of the session. They have the conclusion. They were actually published in Clinical Teacher, and so they will be very valuable for you to read how to communicate these principles with the students. Thank you again for your lunch on or afternoon session, and hope to see you again in the next coming up this session.